Psychologists are far and few between in the state of Idaho. In fact, all 44 counties in our state are considered health provider shortage areas for mental health. To meet the need, University of Idaho is offering a brand new doctorate in psychology program. Thomas, tell us about the new program here at University of Idaho, clinical psychology program that I know that you developed yourself. I want to know about the program and then also the type of careers that people can expect to pursue with this type of degree.
That's a good question. So the degree is a Psy.D, which is a doctorate of psychology. And we've developed this degree to be a clinical psychology program. So it trains doctoral level clinical psychologists. These individuals will be license eligible in the state of Idaho to practice at the top of the license in mental health. So the kinds of careers that people will have are the full spectrum. Lifespan from very young all the way to our oldest population. They'll be able to do both assessment, any type of assessment from psychological assessment, developmental conditions, cognitive conditions. They'll be able to make psychiatric diagnoses, and then they'll also be able to engage in any kind of therapy, from individuals, couples, family therapy, and group therapy. They'll be able to do that across any environment as well, from school districts to hospitals, private practice, prison systems, anywhere. So anywhere where we need psychologists, this is where this program would enable them to jump right into that kind of career.
Wow, okay, so it checks all the boxes for them to be prepared for any need as they move forward in their career. Okay, this is a program that you developed though. Tell us a little bit about your background that you bring here to U of I, and also why is this program in particular so important to our state, especially right now?
That's a great question. So my background, I have a PhD in clinical psychology. I did specialty training in neuropsychology. To do that, you have to enter a program to do a neuropsychology specific track program. And then I did a residency at Brown University in neuropsychology, followed by a postdoctoral fellowship at Duke University. I then remained at Duke as a clinical professor, engaged in clinical practice at the Duke University Medical Center for an additional 6 years. So I was there for about 8 years, and I was hired by the University of Idaho to come in and develop this kind of program to bring more mental health providers in the state. So as you ask, why is this what's going on now? The state of Idaho is facing pretty significant behavioral and mental health shortages across the entire state. North Idaho in particular, the 10 counties that make up North Idaho, the population has doubled in the last 25 years. And the greater Coeur d'Alene-Spokane corridor is about 780,000 people. This will be the only graduate level degree program in a behavioral mental health in North Idaho. So it's critical now that we have this kind of program to address those statewide shortages.
Absolutely, and specifically to the need here in North Idaho in particular. Let's talk too about those specialties that you're going to be focusing on within this program, especially when it comes to the way of the faculty that you'll be hiring for this program itself too.
I'm part of the core faculty here, and my background, as I said, is neuropsychology. So we're planning on developing a neuropsychology specific track within our program. That means students will come in, they'll obtain their Psy.D in clinical psychology, but they'll have an opportunity to become specialists in neuropsychology right from the start. That means their curriculum will be partially related to neuropsychology. They'll be able to do neuropsychology practicum placements and be eligible for that residency year, that 1-year internship, where they go on to really develop as a neuropsychologist. We're also planning on developing a health psychology track. That's where psychologists interact with patients with medical conditions who are then facing psychological stress and other emotional health concerns related to their health. Psychologists specialize in helping those individuals as well. And other faculty that we have here, for example, my colleague Allie Muschlitz, she's a general specialist in all kinds of assessment and has specialty training in understanding how alcohol negatively impacts the developing brain and other neurodevelopmental conditions. So really students can come in and develop all kinds of specialties while they're here and then go out and practice subspecialties in the state of Idaho.
Thomas, when is this program going to be available?
Students can actually apply now. So the application window is open, it closes December 30th, and then the program will have its first cohort of students in the fall of 2026.
So how do people apply for this program?
So if they go to the University of Idaho website, so uidaho.edu, and search for Psy.D, the Psy.D page will have an Apply Now button.
Wonderful. Thank you so much,
Yeah,
Thomas.
thank you.